Naltrexone is a medication that blocks the opioid receptors, and it's used to help with alcohol and opioid dependence. So in order to take it for opioid dependence, one must be free from opioids for at least 7 to 10 days to minimize chances of an opioid withdrawal. For psychiatric conditions, it's also used in people with eating disorders, people who have a tendency to self-harm, and sometimes used for other addictions such as gambling or cocaine, but it's most primarily used for alcohol or opioid dependence. And the dosing typically ranges from 25 to 50 milligrams a day. Sometimes you can go a little bit higher. Usually it's around 50 milligrams a day. So it's been approved for alcohol dependence since 1994. And in 2006, there's a version called Vivitrol, which is a once-a-month injection that people can receive to help with their addiction. It's often used in the incarceration setting, so when people are incarcerated and before they get released from prison or jail, the shot is given to prevent them from relapsing into drugs or alcohol or something that caused them to be incarcerated in the first place. So there are 3 different opioid receptors in the body, and naltrexone blocks all 3 of these receptors, but it most strongly blocks the receptor in which someone gets the feeling of nausea, and so people often feel nauseous when taking this medication. It's not entirely clear how this helps with alcohol addiction, but it's thought maybe it helps decrease one's cravings or urges, or maybe the high or pleasurable effect that people get from drinking alcohol is diminished when taking this medication. So common reactions with this medication include nausea, upset stomach, maybe vomiting, anxiety. More serious side effects of this medication include suicidal thoughts, depression, liver toxicity. But medications are just one approach to help treat with addiction. It's not usually the most effective or comprehensive approach. Usually it's more of a lifestyle, behavioral changes, and this is most effectively addressed with the 12-step meetings, such as Alcoholics Anonymous or Narcotics Anonymous. They also now have these 12-step meetings for gambling, cocaine, or a variety of stuff. So these really get to more the core at the problem of why people are using the drugs or alcohol or whatever it is they're addicted to, and to try to help use like their spirit or their values or the meaning in life to affect their thoughts, the behaviors, actions, etc. So the medications are just one part, but really there's a whole other part to help treat addiction.